I'm Dr Phillip Katelaris. I'm a urologist, a urological surgeon, and I've had the good fortune to work at the Sydney Adventist Hospital for nearly 30 years. Erectile dysfunction is a very treatable condition. In a younger man with reversible vascular risk factors, it can actually reverse the condition. So if you've got a 45, 50-year-old man with a softening erection who starts to lose weight and stops smoking and training, over a 6-month period, there's at least a 30% chance that normal erectile function will be restored. That's a very powerful message. No pills, no surgery, just lifestyle modification. In men in whom lifestyle modification doesn't work, we have vasculogenic enhancing drugs such as Viagra and Cialis. These medications, when introduced, were a revolution in sexual medicine. For the first time, a man could take a pill 1 hour before sex and significantly improve the blood flow into the penis. It doesn't improve libido, it doesn't improve sexual technique, that's up to the couple, but it does improve blood flow and the quality of the erection. And the quality of the erection is so important because that builds self-esteem and confidence, and it removes performance anxiety. And it's performance anxiety that tends to inhibit the romantic and sensual interaction that a man and a woman want together. For men who don't respond to the pills, there's penile injection therapy. This is where we teach men to give themselves a little injection into the side of the penis 5 minutes before sex. It works well, but I must say the ladies in particular aren't great fans. They say it's too medical and it's not spontaneous. But it's something we offer to our patients, and I suggest they try it for at least 3 months. The gold standard treatment for chronic and severe erectile dysfunction is the inflatable penile prosthesis. I've been doing this operation for nearly 30 years in Australia, and without a doubt, it is the operation, I find, that brings the most joy to a couple. People often struggle with erectile dysfunction for decades, and when you bring them into hospital, operate them, and 1 month later activate the device, the change is so obvious. They feel young, they feel vital, and they've reconnected again. And it's something worth considering. Initially, men with erectile dysfunction try Viagra or penile injection therapy, and it doesn't work or they don't like it. And I then say to them, why don't you consider a penile implant? The initial reaction is negative. They feel it's a foreign body, it's not natural. Well, I say to them, putting a hip joint into somebody's not natural, or a knee joint, or a lens into the eye. But what that does to you is restore function. And with a restoration of function is an enhancement of quality of life. And what I explain to them is that the penile prosthesis is totally implanted into the body, just like a knee joint. And if anybody saw them naked in the change rooms at the golf house, they wouldn't know that that man had a penile prosthesis. So it's not something to feel intimidated by. It is something to look forward to in terms of restoring good quality of sexual function. The operation involves coming into the SAN hospital for 24 hours. There's a small incision in the scrotum and discharge the following morning. It takes 6 weeks for the device to settle into the body, for the swelling to go down. There's a modest degree of discomfort, but quite manageable. After 6 weeks, the man feels quite normal again, and at that point I teach them how to manipulate the little pump that's under the skin of the scrotum. There's an inflation and a deflation mechanism. The modern prosthesis is designed to last in excess of 15 years. So it is a very reliable, robust device. So for somebody who wants to restore sexual function after prostate cancer surgery or bowel surgery or having suffered with diabetes, it is, without a question, the gold standard long-term solution.
Bye.